Hi, I'm Ben Kim. I'm a physical therapist here at the Mettler Center. I'm also the physical therapy coordinator, and I have been here for 8 years. And you've been utilizing DFR for the 8 years here. And the utilization for me has evolved as I've evolved as a physical therapist. Primarily, I use it a lot more now, for specific instances, and also for specific purposes. So the two main areas that I would say I like to use it is for acute injury, when people have sensitization from an injury or some kind of flare-up or pain. DFR is extremely effective, in my opinion, compared to any other soft tissue techniques that I've used to try to calm the tissue down and also modulate the pain. And the pain mechanism of what's happening there, I believe it's a neurophysiological response that's happening to help decrease the acute pain sensitization. And that's where I use it a lot in initial evaluations and also beginning of treatment when they can't tolerate a lot of movement or any loading. The second area that I utilize DFR a lot is more with mobility. So people who have difficulty with mobility to certain positions. Traditionally, we learn things like mobilization of movement, manipulation, things of that nature. But what I've realized with DFR is doing DFR at certain tissues prior to doing mobilization really helps just to get the joints moving, particularly in the shoulder or the hips where there's a lot of degrees of motion. And that's where I utilize DFR a lot. And of course, I follow it up with mobilization, stretching, and stability exercises if needed. But ultimately, I feel like DFR is a great foundational technique that I use to help to reach mobility goals, ultimately, and functional goals and strength goals as well. So that's the ways I utilize it the most. It's an effective technique. I use it for probably most of my patients somewhere along their rehab, depending on where they are. But yeah, that's it.